Good evening and welcome to the Healthcare Talks by the Max Institute of Healthcare Management at the Indian School of Business. I am Soumya Shashidhara, the Associate Director at the Institute and the host of the series. Today is the last day of the Breast Cancer Awareness Month, and on this occasion, we are having a conversation around health tech disruptions in breast cancer treatment. Today, the talk is being moderated by Dr. Venkat Sudigali, consultant radiologist for UK, NHS, Ireland, and Australia. He's also the director and CEO of Excell Hospital in Hyderabad, and also dons the hat of an ambassador of UK Royal College of Radiologists and Oncologists. More importantly, he's a student of the AMPH class of 2021. He will be in conversation with Dr. Geetha Manjunath, who's the founder, CEO, and CTO of NIRAMAI Health Analytics. Geetha has led the company to develop a breakthrough AI solution for detecting early stage breast cancer in a non-invasive, radiation-free manner. Geetha holds a PhD from Indian Institute of Science and Management Education from Kellogg School. She comes with over 25 years of experience in IT innovation. Dr. Geetha, so good to have you, and thank you, Dr. Venkat, for agreeing to moderate this session. Before I hand over the session, I would like to thank our partners, ISB's Advanced Management Program for Healthcare and the Equitable Healthcare Access Consortium, a forum of like-minded people who have come together to push the agenda on making healthcare access equitable. I also would like to acknowledge the presence of Professor Divya Sheshadri, Clinical Professor of Marketing at Indian School of Business, who is also a founding member of EHAC Consortium, and his collaborator, Mr. Rajesh Pandit. I would like to now hand over the session to Dr. Venkat for an in-conversation with Dr. Geetha Manjunath. Dr. Venkat, over to you, please.
Thank you very much. First of all, on behalf of the whole class of AMPH batch 2021, I would like to thank the ISB faculty to get this lovely initiative on the go. And I would all, on behalf of the class, would welcome Dr. Geetha Manjunath to this session.
Thank you.
Thank you. Thank you very much for joining us. So, Dr. Geetha, the first question we all want to ponder is, how did NIRAMAI start and what was your journey like? So could you just briefly describe how did you start and the journey you had so far with the startup?
Sure. It's a pleasure to be in this forum and also talking to a radiologist who is our customer. Okay, so actually, my journey and me being an entrepreneur is literally situational and accidental, I would say. As Soumya mentioned, I had a PhD from IISc, so I've always been a computer scientist, right? I always loved doing new stuff, and something like 5 years, 3 years down the line, solving a problem, which is not solved before, and so on and so forth. I have spent about 17 years at Hewlett Packard, and before starting NIRAMAI, I was head of analytics research in Xerox Corporation, Xerox India, essentially. And so we were actually, along with my team as a lab director, proposing many, interesting solutions for existing problems, mostly Europe and in US-focused problems because it's a multinational company. And also we had a small stream for trying to solve for emerging markets, right? Where I feel very deeply about, trying to solve for real problems in India. So around that time, of course, I was solving healthcare, smart cities, and so on. There's a wide variety, but healthcare itself was a major. So talking to doctors and so on. Around that time is when one of my cousin sisters, Bharti, got detected with breast cancer. She was around 38 years old, and it was already late stage, actually, with all discharge and all that. So the doctor said, like, it's really late stage. We will do a mastectomy, but can recur and so on. So and also within 1.5 to 2 years, I lost her basically. In the same period, my husband's cousin also got detected with breast cancer. So two things, one after the other, it troubled me a lot because they were very close to me, both of them. more than family, more as friends. And so I started sort of thinking like, why did this happen? Why couldn't they find it early and so on? So I started reading about this disease. And also as a technologist, I said, okay, we're solving so many other problems. Can we try and do something here? So I started doing research, a couple of my team members as well. And after about 1.5 years of, some of the research, and we'll talk more about it, I thought we had possibly come up with some new thing that, can help this situation. And so I quit my job and started NIRAMAI. Full execution started because it took me 6 months to come out of the company after saying, yes, I'm going to quit, because there were a lot of things in my head and I had to get it relinquished. So January 1st, 2017 is when basically we were on the ground to make NIRAMAI happen. So it's been a long way, but I'm so glad that we at least reached this much.
That's very fascinating to hear, Dr. Geetha. And at the same moment, I want to ask a question that breast cancer is a very culturally sensitive topic in India. So we see a lot of disasters happening, maybe, and that's one of the contributing factors. So to combat that, how do you think your startup or your company is coping up with the situation? Is it doing anything right in the terms of, is it being customer-centric, patient-centric, to explain the risks and benefits and to explain about the cancer in general?
Actually, taking a step back, right? Definitely breast cancer is one of the largest cancer killers. Right? More than 600,000 women died last year globally, and almost 90,000 of them, you can look at different numbers. Some people say more than 1 lakh people lost their lives because of breast cancer in India alone. So it's a lot of women who are losing their lives. And the main thing is that one of them, like as you mentioned, they do not come forward and talk about their symptoms or any of these early signs they probably see. Not sure, but they probably see as well. And this leads to late detection. Most women are detecting breast cancer in their stage 3 or stage 4 when there is a huge lump, almost like 2.5 to 3 centimeters in size. So that is what we wanted to avoid. So what we did was a new solution, which is very simple to administer as well. Because if today somebody has to do a breast screening, right, they need to go to big hospitals where there's a mammogram. And as you know, because of the cost of the mammography machine itself, not many diagnostic centers are able to afford it. It's hardly there in a tier 2, tier 3 city, right? So with that in the picture, and also several issues because of breast density issues, and we can talk more about it later. But essentially, the current methods of detecting breast cancer are not affordable, accessible for Indian scale. And also because more younger women are getting detected with breast cancer, there is also a limitation of dense breast, which affects the possibility of using it on women of India. Now, moreover, people are very shy to disrobe in front of others, and this whole mentality of what if I get breast cancer? So this whole mentality of illness versus wellness, as in like, they all actually wait till there is a last stage of the disease before even coming to the hospital. So all of these are different mindsets and different limitations that we wanted to address. And that is when we came up with the NIRAMAI solution, which is the main thing from a customer centricity perspective. It's completely non-contact, non-invasive, and privacy aware. So what I mean is, like, the lady enters into a booth. She's just sitting like this in front of a thermal sensor. There is absolutely no one inside the booth. No technician or anybody touches the person or sees the person. It's completely privacy aware. This gives a lot of confidence in the lady to actually take the test. And of course, it's radiation free. But the fact that it is, no touch, no see, like, I say changing room experience, She can just come in, close the curtain, and then she actually disrobes. So that has made it a really very compelling solution for the end user adoption. And we've seen this when we do a rural camp or even an urban camp in a corporate, right? Couple of people come in and take the test, and after they take the test, they just go and get everybody around, right? The family, friends. So many times we have extended the camp from 4 hours to 12 hours and extended by days and so on and so forth. So this privacy awareness has become a major plus point. Another major plus point from a customer centricity that you asked is the fact that it's kind of anytime, anywhere. That what I mean by that is the lady doesn't need to go to big hospitals where this is installed. Yes, they can do that as a part of the preventive health checkup. In addition, we do camps, as I briefly mentioned, where we can take the solution to the lady, to the place where they're there. And also women have this nice thing like, let's go shopping together and let's do some things together. So we have this camp mode, which also attracts a lot of women to come and take the test. So this fact that we can actually make it much more accessible to the ladies, very close to their own place. In fact, now we have home screening as well. We take it to her house to take this, to make this test happen as close as that can be. And so these two things, the privacy awareness and accessibility, I think has made a major difference in that option.
The next question I have is, as you know, in the ISB, many of us are wanting to have startups in the future. Some already have startups, some have companies which are running. So we want to know, at the initial stage of getting a startup up and running, what are the difficulties that you have faced in your experience, and how to solve, how to go about them, including from an investor point of view?
So I mentioned that, the idea that we conceived about this sort of new idea of using thermal imaging and AI was in my previous organization. Now, when I quit, first thing was, I had this clout of HP, Xerox, and suddenly I saw that, I was an individual, no more branding behind me. And it makes a whole lot of difference. And I was so surprised and so disappointed with the whole world, right? When you go as just Geetha, you're no one, actually, right? And of course, then you'll have to sort of try and see what we can do. So that was a major shock, right? And of course, there's absolutely, start with zero salary from whatever, lab director. So those two things were like pretty shocking. In about a couple of weeks, I sort of came to terms with it and then said, okay, let's roll up the sleeves and do what we want. And the other big challenge immediately was, because some of the work was done in my previous organization, we had to do the IP transfer, right? And that may or may not be true for many of the startups who are starting. But then what that meant was we had to pay up quite some money, right, to the organization. And also to run the show, right? I had requested 3-4 of my friends to join me, and they had agreed to join. But still, how long will they go without pay, right? And also I told them, Shiva, Himanshu, Revati, these 3 people, they said, okay, and Tara. So, and Nidhi, I guess, of course, we said, okay, just about, let's say, for 3 months, give me time, right? We will try to sort of raise funds. And if we are not able to do it, and I'll let you go to any place you want to join, just give me time for 3 months, right? And so this was the 3 months deadline we put for ourselves, both because, there was payment to be done. And also we want to make sure that we adhere to the promise we made to the thing. So within 3 months, we had to raise the first round of funding, because even to do an experiment, a thermal imaging device at that time, what we were running was costing 25 lakh rupees. And sort of, of course I had some funds, but, I didn't want to sort of use it on the hard way. So all this wanted and required us to basically raise funds. And January 1st, we said, yeah, this is the starting of NIRAMAI. And January 2nd, we started, hunting for investors. So actually, thankfully, because maybe the idea was very powerful, and maybe we knew we had done a little bit of homework as to figure out what was the gap and where we were trying to address. And also maybe because we had some, background in previous jobs that we have done, the investors were actually taking us seriously, right? And in fact, some of the investors were introduced by my colleagues at ISC, my classmates, ex-classmates at ISC. So there was some kind of a warm contact. So with that, okay, just go in front and then you do the pitch. And so actually we probably pitched to quite a few people, 10, 15 people. And then thankfully, the first two pitches that we did, both were successful. Both of them were interested in going forward for next round of discussions. And so almost like it took 1 month to convince first Pi Ventures is our lead investor for seed round. And so these are AI fund, like, Pi Ventures, the theme is to use AI for the 10x way, differentiation with the current technology. So that's what they say. And so with that, Manish Singhal, Numa Kant were pretty happy with what we had proposed. And of course, they had a lot of questions. And we didn't have the answer in the first thing, right? Of course, we had some vague idea of business model, but when you go into the next level detail, what could be pricing? How would you go to market, all that. So you have to go back and sort of look at how is it done in diagnostic centers today? What is the current workflow? How do we fit in? So all of these and also market size and all of that, we had to go back and then, study and then go to them with full answers, and within a month we actually had term sheet. So the first problem was really to raise the funds and get the right pitch and right alignment with the investor who would believe in your vision. Having a common vision or alignment with the vision with the investor is very, very important, because at the end of the day, you want to stay with it. It's like a partnership. It's almost like a marriage, right? They stay with us for a long time, and we need to sort of make sure that the end goals that we have is same. Of course, there will be variations. Of course, there will be financial implications, as opposed to sort of when I quit my job and started, I really wanted to make a difference in the life of women. And that was my main thing. But definitely we have to do it in a way just financially sustainable. So all these elements are the first and foremost. Second is, as a person from not really a medical kind of background as such, though I had worked in healthcare for about 10 years in IT type mode. It was very difficult when I actually went to a radiologist such as yourself, Dr. Venkat, and then say, okay, here is a new solution to detect breast cancer. So why don't you try it? I said, wait a minute, I've never studied about this before, right? And but what you say sounds interesting, but I'm not confident of giving this to my customers, right? Because obviously it's a life and death decision, right? The cancer or no cancer kind of a decision. And how can I depend on a tool like you? That is one setup. And then we went to the healthcare, the providers, the directors of health hospitals and so on. They said, okay, you're a small startup, and how do I know that you will stay for a long time? You will give me a solution and close down the startup, and how do I trust you? So that kind of more, economic viability as well as sustenance of the service itself was also a question that was asked. And finally, women, as we talked about, of course, women were very happy actually. So that was literally the hope that we had. Every person, when I said, okay, this is what it is, and here is a test, take it, everyone was happy, because it was so simple to take the test itself. As long as, it is appreciated by the doctors, they were very happy to do. So these were the 3-4 starting problems. So we started, looking for hospitals to partner with. And I had given a talk in one of the conferences, more from a Healthtech perspective about this. And in the audience was, Mr. Hemant Kumar, who was a chairman of BMS Hospital, and that's where I think the first customer happened. So he came in and said, I really like the idea, and I think it's going to be really helpful to women. How can I help you? And at that time I didn't have funds, so I tried to sort of see if he can be an investor, but he said, I don't have that kind of money. So I asked him, can you actually allow us to put our solution in your hospital? And we will ensure that we will not do anything wrong to your end users, right? And so that was a starting point. And even now, BMS Hospital in South Bangalore is providing this solution for the last 3 years now. A very happy, customer. It's a small hospital. The number of people walking in itself is less, but yeah. So that was a difference. Obviously, there was a lot of grilling discussions and reviews by the doctors, governing council, and so on to get there. And most importantly, they said, okay, you will give a report, because we generate a report automatically. But who is going to take the liability of this report? right? The medical legal liability of this report, right? Who's going to do this? And so then we had Dr. Ramprakash sir, who was an expert thermographer, and we had worked with him to actually do some evaluation, clinical evaluation also. So so we went to him and said, here are the thermal images, and we have the report, and thermal imaging, so you can actually validate as well. So he agreed. He said, I have actually tested your solution for 300 people, and I completely trust this. Still, I'm going to review and do the signature. So once we got a doctor to sign our report, which means the legal, medical legal aspect is taken away from the hospital, and we are not doing any side effects or any issues, and we're not creating any additional issues to the end user. So we were able to launch the product in August with the BMS Hospital. So within 8 months, we were able to launch the product. So it was very grilling. We didn't know like where we were going, but a lot of challenge by God's grace and sort of collaboration with the medical domain, we were able to sort of give the first solution basically in one deployment.
That's absolutely fascinating, Dr. Geetha. Really wonderful and inspiring for many of the audience to listen to.
Thank you.
Two questions which I wanted to ask. I read about NIRAMAI on the website, and also I got to know you when we were speaking previously. I think a couple of unique things about your startup is what I noticed is one is the full stack model, because you have hardware, you have software, you have end user, you also have shop in shop model. Yes. So which is actually quite unique in healthcare, in my opinion. I don't see many of the healthcare startups having these kind of models. So how did you come about? What was the idea behind it? And how did the investors react initially to these kind of ideas?
I think it's a very good question, Dr. Venkat, because initially we said, okay, it's a computer science software, right? We put it on the cloud. Though why don't people buy a thermal camera, attach it, and we'll just do the software. But then the first problem, as I briefly alluded to before, was who will sign the report. So that was one question our customer asked. Then we got this panel of radiologists. Of course, initially was Dr. Ramprakash sir, but then of course we had Dr. Sudhakar and afterwards Dr. Shailja. So we have a 3-4 panel of radiologists who would actually receive. They have, right now they have a mobile-based system. So as soon as we screen it, actually goes to them the signature is put, and only then we give to the end user. So this is the medical legal aspect. Second aspect was we said, okay, we will have. Who will actually go and buy a thermal camera from the vendor? So when you go there, like he was saying, 12 lakh rupees and so on and so forth. And, there was a hesitation from the first few customers saying that, I don't want to invest so much money while I'm still trying out your solution, right? Then we said, okay, fine. We will give we will actually work with a vendor to have a better pricing, because we can say so many we are buying together and all that, right? So kind of a vendor arrangement so that we first reduce the cost. And then we also started experimenting with different other models which are more suitable for this particular lower cost, but suitable for this particular use case. So with that, we thought, okay, instead of the user buying any thermal camera and we're not even able to give a guaranteed answer, so we said, why not combine hardware? We do not make the hardware as such. We partner with the vendor, identify because thermal cameras are commodity today because of their use in. You would have seen COVID screening in airports with thermal imaging devices, and building maintenance and the surveillance system. Some of you have seen the Uri movie, where there is a border kind of variation. So where the army people or Air Force people really have to look for any intruders in very, very cold situation, they use thermal cameras. So like that, these thermal cameras, because of the defense usage as well, have improved a lot and are available like offline, off the shelf kind of use. So with that, we decided to partner, but then only if we bundle and say with this thermal imaging device, our solution works, there is more comfort to the end user, right? Otherwise, we are not taking liability to the end-to-end. So that is how we decided. We'll put the hardware, we'll put software as well, and couple it with the doctor who's certifying. Provide this as an end-to-end managed solution. Then the question came is like, it's such a simple solution. Do you really need a doctor to do the test, right? So that is when, of course, we were only, at that time, I have done so many camps, gone to villages and all, and I myself have screened people. Otherwise, you can't understand how the dynamics, how you have to kind of, refine the software and so on, and what are the, what is the feedback on the ground. For example, we were actually initially putting the camera and the laptop next to each other. Then, we were not having any privacy awareness at that time. But when I saw, of course, I was also feeling uncomfortable as not coming from a doctor's sort of complete treatment kind of background. So I was feeling uncomfortable seeing a person, not wearing clothes, and she was feeling uncomfortable. I just thought, okay, the sensor, we can keep it that side and have the laptop this side and put a curtain in between. So we just, the next camp, I said, why don't we just put a curtain? So we put it, and bingo, it's just really a magical experience change. And this could be done because I was on the ground, right? Both actually, Nidhi and I, both of us were on the ground trying to see how can we, what can we learn from this experience, right? So the second camp onwards, we started having, and it's become, like I said, an important factor for adoption itself. So whenever you're fine tuning, right, we need to eat our own dog food. I have taken my own this NIRAMAI test for like so many times itself to see what else we have to finalize and fine tune and so on and so forth. So all these fine tuning that had to be done were done, and also discussing with the customers, right? So now coming to the shop in shop question that you mentioned is where we said, okay, if we actually have doctors to do the screening, then it's again the scalability gets affected, because we cannot have doctors on the roll every time we do a rural camp or any other camp. So we made it so simple, because doctor is anyway going to review it. So we could, especially for a full report, we call it diagnostic report that we generate. We started training simple technicians with just because of software-based analysis. So we have a training program, 2 days training program. We put them as our associates, train them, and so on. So we started making simple technicians as well. So that gave us an idea that, why does it have to be in a hospital? It can be outside a hospital. In fact, in Hyderabad, in Jubilee Hills, we have it in a mall. I think it's called Jubilee Jewelry Mall or something. So where we have the whole mall, and this is also yet another shop. So, people can, it's like a simple, nice lounge. You can sit there, buy saris and below, and then buy jewelry if you like, and then go sit there and take the test in a small room inside the, in the mall itself, and come out and have nice food after COVID, I guess, and then go. So this kind of a casual nature of screening, we started experimenting with our partner called Umang. Is the Ushna Mapan something? There is a Hindi expansion to it. It's called Umang. The center is called Umang. So we started doing that. So this is basically documented. Is like on experience. It's more like fine tuning of the product itself, which enabled us to get this end-to-end thing going. Finally, we said, okay, it also has to be collaborating with Karnataka Cancer Society. We said it also has to obviously help women who've never seen a doctor for ages, right? Almost these are rural areas. And so we collaborated with Karnataka Cancer Society, went there, and then started doing these camps. There, what we said was we will review and send the results back in 1 week. In 1 week, you send the results. You're not able to find out who is that patient who took the test. Patient number 007 is missing, because she would have come from different villages from somewhere else, no major address, nothing. There were like 3 Sharadammas, and 1 Sharadamma was red, and we didn't know how to find this, right? So this gave us an idea that we need to do something real time. We cannot let the person go away and then try to find it. So we innovated to actually come up with this triaging solution, which is the next level of technical enhancement, where immediately it gives a red yellow green. We call it traffic light output, where as soon as the scanning is done, within 2 minutes, it gives a red yellow green, a chit. In that chit, it's written. And if a person is found to be red, she is taken aside and all her details are written down. If possible, we take her immediately to a nearby health center to do an ultrasound. and then finally diagnose and help her even to go for a treatment. So this, real-time nature of that was also an innovation that we had to do, an enhancement to our product because of the situation, and learning on the situation. So many small things like this helped us fine tune it to be this end-to-end managed solution, and trying to adopt it to the requirements on the ground. Dr. Venkat.
Wonderful. Very nice to hear. A question which I and every one of us have in mind is that, as we all know, 90% of startups fail. Healthcare startups have been in focus since the last 6 months, especially due to COVID, because that's where the investor focus is, the patient's focus is, the end users, the hospital. So everybody is thinking about healthcare as the next big thing which is coming up now. Do you think post-COVID also the same remains in terms of the startup valuations or the investor interest or the customer interest, the patient's interest? Do they still want to have this technology instead of face-to-face appointments with the doctor, the usual conventional hospital appointments, instead of going to a shop having their tests done? So how do you think long run the health tech revolution that we are seeing this year will stay?
Definitely, I think all of the good stuff that we're seeing evolving in telehealth and telemedicine is going to stay, according to me, for the reason that what telehealth has done is not just brought the doctors to homes of urban areas. It can actually evolve to become almost like remote healthcare facilities for our rural segment as well. So this again, instead of standing in line and queues and so on and going in the traffic and meeting the doctor, and doctor being so busy with so many patients around, not having time to drink, eat food, whatever, right? So all of this can definitely be alleviated using this remote health. Obviously, not everything can be solved with remote analysis. So my thought process is that a combination of AI-based devices such as ourselves, our technique where there's a point of care device done by probably health workers who will actually, because everything can't be just on phone. You need to be basing it on data, like could be health vitals, what's his BP, sugar, whatever, right? The health vitals or any other type of test that needs to be done. If it can be done in a point of care, using point of care devices, and also some kind of intelligence there to actually call in the doctor as and when it is required, or some kind of an analysis done before, so that that data can be used for further diagnosis by the remote doctor. I think this combination of the AI-based devices, telehealth infrastructure, and remote working is going to stay because it is going to be comfortable, affordable, and also accurate with that, and so that makes it more feasible. Right now, because of COVID, there's also trust building and dependency on this that people are comfortable in accepting. For example, earlier they were not at all comfortable talking to a doctor who's remote, right? And same the other way around, doctors feeling comfortable treating a patient remotely. So that comfort and the trust is been established, which was a gap, which is being established now with COVID being a trigger, and that's going to sort of remain, right? So that is one bit which I feel that all the innovations that are being done here are here to stay. Furthermore, what is happening is because of COVID, people are hesitating to go to a hospital, and a lot of these non-COVID issues are piling up, and doctors, and you may also agree, Dr. Venkat, that, we're all worried, even epidemiologists are worried that the non-COVID related diseases will actually take over, many issues, health issues in future. So we need to be better prepared, right? So that is another big thing that, where we need more and more innovation, because today, if you look at IT, affecting any of the different domains, maybe customer care, transportation, all of these, yes, we are seeing inroads already, but healthcare is the one which is the least affected, and a huge opportunity to make a difference. So yes, there is a huge opportunity for IT, making a huge difference in health tech, even moving forward, in my opinion, actually.
One more question. As anybody related to healthcare, like you and me, whether doctors or non-doctors, anybody related, we are all having a component of social entrepreneurship.
Yes.
And obviously, you are doing quite a lot, which will dynamically affect the population's health. Now, within our country, like India, where the accessibility to quality healthcare is a major issue since a long term, and even things like preventable illness like TB is still having a lot of incidents. There's an issue with diagnosis and treatment. Do you think NIRAMAI can solve to a certain extent this problem? And obviously, you have got point of care technology, which is just wonderful, and that can go to any part of the world, any part of the remote areas. So, do you have this kind of an idea for the future and how the company can develop in this manner?
Yeah, definitely. Because the technology that we have developed, which is a combination of thermal imaging and AI, is not just for breast cancer. It can be enhanced to actually detect several abnormalities, different type of cancers, different type of vascular abnormalities as well. And we at least my vision is to actually sort of make that happen, right? I mean, it all depends on multiple factors. But I think, the grand vision is literally sort of make point of care devices in a non-invasive fashion, and also in a way that simple technicians, simple health workers can actually administer it, with a possibility of bringing in the expert advice and expert review with a click of a button, because everything is now cloud enabled and point of care devices. So these two combinations, enable this to be done. And I really hope there'll be a time where the person just stands in front of this thermal sensing device, and our AI is able to detect at least 100 different diseases, or predict that may happen, and pull in the right doctors for preventative measures. I'm really hopeful. Maybe I'm dreaming, but that's what I feel can be done. Whether in my time or later, somebody can pick that up.
Well, as I say, you have to dream initially to make it a start. So wonderful.
Thank you so much.
Great ideas and great conversation.